thought of a career in the South Staff's PCT, which is your local NHS? Well, let me tell you, there's loads of jobs on offer. But before I get on to showing you just a few of them, here's where it all started 60 years ago.
Suppose your wife falls ill suddenly.
Now, believe it or not, before the NHS, you had to pay for healthcare, meaning many people couldn't afford it. But in 1948, all that changed, with a free health service for all, regardless of how much money you had.
It's all yours, whenever you want it, with your own choice of doctor. And that goes for the whole family.
Now this fella, Aneurin Bevan, is the man to thank for it all. So don't you ever diss a Welshman. Okay. You did soon have to pay for prescriptions, but it was only £1, which is 5p today.
A vaccine against polio, only it's taken just like medicine. It's cherry-flavoured, so there's no difficulty with kiddies.
Back in the 1950s, polio was a really nasty disease. But thanks to a vaccination programme, you don't hear of it today. Open them up. By the 1960s, the first kidney transplant involved a set of identical twins. And pretty soon after, the contraceptive pill was made available on prescription. Now, can you imagine needing a new hip? Well, in 1962, this became a reality. Why, did you know that CT stands for computer tomography? And by 1972, this is how doctors started looking inside the body. By the end of the 70s, we had the first test tube baby right here in the UK. This humongous 1980s Polo Mint is actually an MRI scanner, and it's used to look at the body's soft tissue using magnetic waves. People didn't realise about the dangers of AIDS until the 1980s, after the politicians launched a massive advertising campaign. 3 really is the magic number. In 1987, there was the first lung, liver and heart transplant. Yeah, all at once. Breast screening has only been around for 20 years, but it's made a real breakthrough in breast cancer care. The Community Care Act in 1990 was the government's way of supporting healthcare in the community. A year later, 57 regional NHS trusts were set up all over the place to make it easier to get care closer to home. The organ donation service was started in 1994, and the NHS Direct service was launched in 1998, giving 24/7 health advice over the phone. Science fiction becomes reality when you find a robot in the operating theatre. The robotic arm started flexing its muscles in heart operations earlier this decade. So what makes 2002 so special? Primary care trusts were launched. So what exactly is primary care?
Primary care is the front line of the health services for people in this country.
First place that they would really go. It can be a GP, it can be a dentist, it can be a midwife.
What we try to do is to see patients as close to their home as possible.
Occupational therapist, physiotherapist, district nurse.
The first point of contact for your health needs.
Ensuring that the residents of South Staffordshire have got the right health services, and that's our job.
So what about your local South Staff's PCT? Stand by for the facts. With 600,000 people to care for, there's nearly 400 GPs and 80 dental practices, and there's even primary care jobs going in 6 prisons. With over 2,000 people working in the PCT, there's quite a few jobs on offer, and to find out just a bit about some of them, we met up with the Cox family, who span 4 generations going back at least 60 years, so they know a thing or two about the NHS. Now this little chap's Jasper, who's just 3, and his brother William, who's 5, their mum Claire, and her mum and dad Mike and Gay. Now Nana of the family is actually in hospital herself. Between them, they've got a few tales to tell about the health service, so we invited them to the diary room. And first up, it's Claire with Jasper.
The school is well supported with children's services, which range from nursery nurses to the school nurse who checks the children's hearing, and speech and language therapy, the health visitors who do the vaccinations. There's a whole range of children's services out there.
Meet Teresa. She's been a speech therapist for 5 years, but by heck, does she enjoy her footy.
We see children who've got voice problems, so they are usually children who shout a lot and and do a lot of funny voices or screaming or things like that. So those are the more challenging ones, shall we say. Okay, spiders on. Right, let's see how many of these sounds you can catch. The best bits are actually seeing the children and dealing with the parents, having that face-to-face contact and seeing the changes that you achieve. That's really rewarding. You got it!
Catherine's been managing children's services for the last 7 years. I wonder what her identical twin does.
I manage services like speech and language therapy, health visiting, school nurses and the children's community nurse teams. I specialise in seeing transsexual patients, so people who are born in one sex but who actually are convinced that they should be another. And then I see them for voice therapy to try and make their voice a little more feminine sounding.
Now Elaine's been a community dietitian for 5 years. But I don't know what started her on the saxophone.
Being a dietitian is a job that men and women can do. I'm a community-based dietitian, so I get to travel around, visit people at home, and to work in different clinics and make some phone calls and complete the notes. Right, so tell me a bit about what you're eating at the moment. The strangest thing I've ever done was I had to analyse children's poo to find out the vitamin and mineral content. I'm just going to move this down so it touches your head. It's very rewarding when you find that you can help children to feel better. Okay, you're 144 centimetres.
Our experience of the dental service has been really brilliant. They're usually really friendly with the children.
And usually our dentist is called Mr. Briggs.
I love my job. You get to meet a lot of people.
Now, well, we couldn't get hold of Mr. Briggs, but Paddy here has been a dentist for 12 years. That's when he's not headbanging.
The best bits about the job, I would say, is helping people. They tell you that you're the best dentist in the world. It can also be a bit disheartening to hear patients come through the door and say that they hate dentists. There's quite a few different careers. As well as the dentist, there's receptionists, dental therapists, dental technicians as well. The one thing that you couldn't do without in dentistry to do your job is a dental nurse. And then smile. The training for dentistry, it's 5 years. No 2 days are the same, but you'll never stop learning.
Now it's Gay's turn to come to the diary room to tell us about who's been looking after her mum.
Last year she knocked her leg and this was treated very, very well by the district nursing team.
A district nurse for more than 12 years, Sheila's tap danced her way around many a patient.
We cover a very wide area, so you can do anything from 6 miles to about 40 miles, but the majority is out and about in patients' homes. Hello! Morning, Tony. And it's nice just going to see people in their homes because you actually see the whole picture. You learn a lot about how they are, what the families are like, and it's nice. It's a lot more personal in a way. Well, this is really good. I haven't seen you for a couple of weeks. I think rewarding is providing all the support and care you can, be it that you get somebody well or if it's towards the end stages of life, they get their wishes, be it that they want to stay at home with the family.
See you soon.
All right, see you soon. Bye.
Take care now. Bye.
I wouldn't call them nurses, I'd call them angels.
Now Daphne's another angel, a community nurse on the evening service. But sometimes she swaps her wings for a parachute.
We're responsible, obviously, for all the patients. They're given our number for us to treat them if they need any treatment out of hours. Hello there, are you okay? Worst bit, I think, is driving across fields full of mud in your car isn't always the best. Yeah, it was 88 before you put your oxygen on. Right. And now you've got your oxygen on, it's gone up to 92, so that's really good. We're in contact with a multitude of disciplines, social services, ambulance crew, you name it really, we're in touch with everybody. Strangest thing in the job, I was having to climb through somebody's window to gain access. If you need us, you know where we are, don't you? Yeah. On the whole, nursing, if you want to do it, I'd go for it.
She's been seeing the dietitian because unfortunately she's not been eating very well.
For the last 18 years, Gillian here has been an adult dietitian, when she's not racing pigeons, that is.
I'm a qualified dietitian and I'm currently a specialist in care of the elderly.
I have responsibility for the nutritional care of patients on a day-to-day basis. Hello Marion.
Hello.
Hello, shall we go through?
Yes.
Typical day for me would be to go and visit the patients in the wards. I visit patients at home as well, so I might have 1 or 2 home visits a day. Is there anything you want to ask me?
No, I think everything's fine.
It's a very, very busy role. You need quite good time management skills to keep on top of it. There's such diversity, and I really feel that I can make a difference.
As a consequence of my mother's general ill health over the last 2 years, she's become a little bit confused and was visited by the community psychiatric nurse.
Steve heads up the mental health team. It's a far cry from his previous job fixing combine harvesters.
My job is professional lead for mental health and learning disabilities. It's great in the sense that I'm able to influence mental health care across South Staffordshire.
Gemma here is a bit of a skateboarder in her spare time, but she's worked for Steve for 3 years.
There's 3 aspects to this role. One is seeing clients on a one-to-one basis, doing group work, and we also do mental health promotion.
The biggest aspects of people with those particular problems are that they tend to think very negatively. So that people tend to be very hard on themselves when they're not feeling at their best.
The main part of my role is to see clients in their GP surgery, helping people to feel better.
And to see them actually get their life back is very, very rewarding.
And the difference that we've made is the best bit. Yeah.
We were introduced to the social work team, who spent a lot of time with myself and my mother.
Good old Roy has been a social worker since the year dot. I reckon he's been playing the drums that long too.
We go out and do an assessment with a view to stemming off problems. Not judging them, but sort of assessing what's going on and then fitting that assessment to need and then providing the services to meet that need. Are you having any more difficulties at all? Very demanding job as well at times, but enjoyable.
Now get a load of poor old Michael's story.
I was up a ladder and I fell about 12 feet and shattered both my wrists, and that was my introduction to primary care. I had about 12 hours of surgery to rebuild my wrists, and the surgeon told me that the most important thing after she'd done her job was to actually do occupational therapy and physiotherapy.
Occupational therapy is Trish's game, and she's another one who fancies herself as a bit of a drummer.
I'd recommend a career in occupational therapy because then you actually follow the patient through the pathway, seeing them at home, through the community, and actually getting them back into whatever they were doing beforehand and keeping their independence. We use a lot of basic tools in occupational therapy for a rehab. Now we've actually got the WE, and that's up and coming and is used far more in rehab, and research is out there saying this works.
Say if you need to stop.
The worst part, without a doubt, is people's homes. We've been to one house where you had literally a tiny little walkway through downstairs, clutter and everything just piled up on the tables, and then having to clear all that out knowing that actually there's fleas and everything in there. Not nice.
Paula has been a physiotherapist for 12 years, but sorry, she wouldn't tell us how she got her nickname.
What I love about my job is the ability to improve people's quality of lives.
Have a seat there, my love.
There aren't really any worse bits about my job.
Okay, bend the knee for me, June.
Once you qualify as a physiotherapist, all that does is give you a passport into the profession, and you can travel all over the world with it, and it's great.
Well done, June.